You everyone for joining. Very, very delighted to have you all. And it's a pleasure. I think I know some of you, a handful of you. I have my medical students, staff joining as well. And it is an interesting topic that we're going to talk about, hormones in you. So again, this is Dr. Chhaya Makhija. I'm an endocrinologist right now in Fresno, California. And I know many of you have seen me either in person or telemedicine. But we are going to learn a very simple topic today, which is basics of hormones, because it's essential for sustaining of our life. So the way we're going to start today is I'm going to share my screen on the PowerPoint. We'll talk about it for 30 minutes. If you have any questions, feel free to put that in the chat box, and we will be discussing these at the end of the session, and that will be enough time for almost 20, 30 questions if those are short and succinct. So let's start, and I'm again delighted to have you all on board here. Okay, just to confirm, you're seeing the Hormones in You presentation?
For me, it's shown up. Yeah, all good.
All right, very good. So again, you've already had the introduction, and I just wanted to again share that this is going to be recorded, and a lot of Q&As, but no specific personal medical advice or medical discussion related to individuals' health. Who am I? Many of you know me. If you don't, I am a student of life, so love learning from patients as well as life's experiences. I have graduated. It's almost 25 years in medical school, and my specialty is endocrinology, which is specifically diabetes, endocrine, and metabolism. And I've also had lots of self-experiences as patients with different specialists, so I can really feel and hear you out. And that's my goal, to be a very, very good listener as much as possible at my practice. Now, my practice is called Unified Endocrine and Diabetes Care. The reason unified is integrating lifestyle medicine, whole person care, along with the endocrinology expertise. Along with this, I also bring food as medicine, exercise as medicine, physical activity, along with laughter. I know many of you join me in laughter sessions and some breath work, because all these are key ingredients as a medication, as a tool for your health. Another important thing that I wanted to share this with you is I'm going to share patient stories, and that will re-emphasize the mission for my practice, for myself, as well as the reason that I am sharing this with you to the community as a webinar, which will also be recorded on YouTube, so that more and more individuals can get empowered with the right tools, right evidence-based science, and you yourself can advocate for your health, and that would be a great success. If you had to follow me, I have a new YouTube channel as well as social media handles, which I'll also share at the end of the discussion. Okay, so let's dive into hormones and you, right? I'm going to cover basic concepts of physiology, and this is like one of the first classes even at our medical school when we dive into what are these hormones exactly. Common myths, because there is a lot out there which leads us to misinformation and misbelief. So here I'll be sharing all the evidence-based science with you. And then strategies on how to approach your care, how to seek the right medical expertise, and also how to get the right resources. We'll also integrate or learn to integrate the clinical aspect and lifestyle medicine aspect of medicine. And of course, lots of question and answers with you all. Okay, so why do we care about hormones? Well, messengers, right? They are cross-talking. So these are chemical messengers, and every cell is talking to the second cell. It's like, imagine an entire world of cells, which are millions and millions of those, and they cannot talk to each other. They cannot function. They cannot work as a team if there are no hormones. So that's why we are talking about it and how crucial their existence is for us. Endocrinology is study of hormones, It's very vast. Our education or our fellowship includes diabetes, endocrine, and metabolism. And in one term, it is determined as, or it's called as endocrinology. Okay, so why do we care about hormones? One, yes, they are helping with the crosstalk and the functioning. But what's important is that they govern our mood, our energy, our muscle mass, our responses to blood glucose, to blood pressure, to stress, to anxiety, to, having joys and cheers versus depression and sadness. So they play a major role in our well-being. And they are also being secreted at every second, every moment, every minute. They vary, they adapt to changes. They may be very different when we are growing up. They would be very different when we are reproducing. They would be very different when you have a social connection, when you're bonding. They would be very different when you are, appearing for a board exam, or there is a major stressor in life, or hospitalization. And that's why it's never the same. Okay, this is what's, I would call it as a greatness of our body, that it can adapt. When it cannot adapt, that's when we land up in imbalance or a disease state. On the right-hand side, what you see is crucial hormones. So 3 important ones, which you should never neglect, is cortisol, thyroid, and insulin. We cannot sustain life without these. I'm just going to put in my pointer so it'll be easier for you to note the right and left side of the screen. So these 3 crucial elements of hormones are going to be necessary. And if someone's deficient, they cannot sustain life, and it requires the right therapy or the hormone replacement therapy. All right. The next part is, how do they do the crosstalk? Okay, this is the endocrine system that we tend to learn from the human body and the Mother Nature's creation. So if you take a look on the right-hand side, there is your brain, and then there are multiple colored organs, which are basically your endocrine organs, top to bottom. So I would say from the neck below until the gonadal system. In the brain, we have 2 important organs, which are the hypothalamus and pituitary. And these are basically your command centers. If they do not exist, none of these peripheral organs are going to function. Okay, so they are dependent on this command center to send signals, to send actions or action plans, and then they will follow those plans. On the left-hand side, you see pituitary and number of hormones listed, and these are the exact ones that would be released or produced or manufactured in the pituitary gland. There's growth hormone, there is something called as ACTH for cortisol, there is LH-FSH, important for estrogen, testosterone production, thyroid, TSH, prolactin for lactation, oxytocin as a bonding hormone, that would be the simple way to describe it. And even salt and water balance is an endocrine system or endocrine system responsibility, along with other aspects. Okay, so endocrine system is not just one organ. The number of organs it's affecting is everything. So thyroid, liver, lungs, your pancreas, your heart, your sympathetic and parasympathetic nervous system. That means your fight and flight response and your rest and digestive system as well. Okay, so while this crosstalk is occurring, we as endocrinologists, when I'm talking to the patients, how am I approaching or how am I understanding or correlating their symptoms with what's happening in their organ system? There is a constant crosstalk, which I'll be using frequently. And what is that crosstalk? So take a look. This is the larger visual of the pituitary gland. Now, it is at the base of the brain. If you had to make a straight line between your eyebrows, that's where the pituitary gland is sitting. It's a tiny pea-sized gland. So imagine the size of the pea and the size of the brain, but pituitary is the command center, and the amount of functions that it governs helps to sustain life. Crucial organ. This is sending signals, to example, to the thyroid. It's sending signals to your adrenal gland, which are on top of your kidneys. This is sending signals to the ovaries and the testicles. If these signals are impaired, none of these organs are going to function, okay? So as endocrinologist, when I'm talking to patients, I am looking at these hormones, but I'm also assessing the pituitary hormones to figure out where is the problem in the crosstalk. Now, Another important aspect is, say, if this organ is diseased, or it is affected, or it's overfunctioning, it's basically behaving like a rebellious teenager. Okay, so it's not, it's negating all the inhibitions from coming from the pituitary. I don't need any command center, I'll just function myself. What happens then? Well, it sends signals to the pituitary that, hey, I'm overproducing. I enjoy to overproduce thyroid hormone and make this person miserable. Stop sending more signals to me. And pituitary will respond saying that, okay, you don't need any more signals. So this is an example of conditions like hyperthyroidism, or in adrenal glands, it's called as Cushing syndrome, too much cortisol, okay? So the crosstalk is not just one way, it's both ways. And this is what is called as positive versus negative feedback system. And that helps us to maintain the balance or the homeostasis in the body. The harmony is very crucial here. Any disruption in the harmony, like age, pregnancy, postpartum period, major stressors like major illnesses or hospitalizations, personal loss of either wealth or family member, as well as how we cope with stress. So, if someone's stressed about every little thing, and how they respond to stress is also affecting the endocrine system. Infections, inflammation, autoimmune disorders, hereditary or genetics play a crucial role in causing certain diseases in endocrine system, as well as trauma, tumors. But you'll be surprised about poor nutrition. So I have three colors here, or three very modifiable factors in different colors. So stressors, inflammation, and poor nutrition is what we're going to also dive into further, because there are certain things that we could modify, we could change to either avoid a disease, prevent a disease, or get back to a balance, okay? Now, on the right-hand side, what you're looking at is what can we do if there is an imbalance? So specifically for my patients, or if their family members are dealing, or if they're asking me a question, first thing is seek the right medical expertise. There would be lots of hormone experts out there who may claim themselves as hormone experts, but in medicine, just like if there's a heart problem, you want to see a cardiologist, right? If there is a brain problem, you want to see a neurologist. Similarly, when there's a hormonal disturbance, there are not too many specialties. It's either endocrinology, or for females, there could be certain conditions which a gynecologist would be handling it or would be the expert. And in men, if there is reproductive dysfunction or testosterone deficiency or prostate problems, urologist on board would be very, very important. Everything else does not have any specific expertise in this aspect. The reason I'm emphasizing it, because there is a lot out there which can again lead to misinformation, incorrect hormone therapies, as well as inadequate hormone therapies if someone's needing the right dose and the right treatment. All right. So where is this stressor? The three factors, right? Stressors, inflammation, poor nutrition. How is this affecting our hormone or endocrine system? Take a look on the left-hand side. This is my favorite image that I still share with our students, my patients, as well as in training physicians as they are going to become the near future physicians. Our life in the modern era, busy lives, sedentary jobs, on the go, drop the kids off in the morning, jump up and get ready and go to work. Maybe the breakfast or the coffee or the beverage is going to be in the car. Maybe you'll sip on it for hours and then feel like, I'm not hungry. Let me skip lunch. Let me skip breakfast. Number of phone calls, trying to multitask. Thinking that I should sleep less so I get more time to do more stuff, right? All this is putting us on a constant, it's called hyperadrenergic drive, hyperadrenaline drive. So you're constantly working with these stress hormones, the adrenaline. And how is that impacting us when it's happening daily, consistently? It's leading to breathing problems. It's leading to high blood sugar, high blood pressure, are affected with this kind of a lifestyle. And of course, it's affecting our our hormonal system, our what I talked about, the negative and the positive feedback signaling. It also affects the reproductive organs, menstrual cycles in females, and the testosterone levels in the males. So what can we do? There is a lot. Okay, so when you take a look on the right side of this flow chart, which also describes the poor nutrition, which is more packaged foods, preservatives, along with the exposure to the pollution, all leading to disease. It's disease and imbalance. And that's led to lifestyle diseases on rise, autoimmune conditions, as well as several cancers, which have been on the rise since the last 2 to 3 decades. Okay, so we have time to change. You have the time to get the right expertise, think about prevention, and take charge. That's what I want to empower you with today. This is from CDC, that's the Centers of Disease and Prevention, where they specifically mention that other than tobacco abuse and excessive alcohol abuse, look at 2 other reasons, risk factors for causing chronic diseases, which is diabetes, heart disease, stroke, multiple cancers, as well as autoimmune conditions, poor nutrition, and physical activity. That's the saddest part in United States, where we are a wealthy nation, but very poor in getting a good nutritious supply of food, including in our kitchens or even in our workplace. I won't be going in depth on this slide, but I usually share this in all my webinars or all my talks, that how crucial it is important it is to add fiber, to add whole foods, to add vegetables and fruits, because they have insane amount of benefits. Even for your mental health, your hormonal health, your bone health, your heart health, your neurological prevention of Alzheimer's, dementia, everything is going to be dependent on what kind of food I feed myself, and that is food is medicine. Okay. So as I'm talking to you about the physiology or how a disease state occurs, let's look at some real patient stories, which are patients who've seen me and are still are under my care, as to how their hormone evaluation has led them to a better health outcome, or seeking or getting the right diagnosis and the right evaluation. So this is a 39-year-old female. This is case 1, where the patient had 5 years of absent menstrual cycles. Now, absent menstrual cycles in an individual who is 39 is quite early, okay? This is not pregnancy. She was seen by her primary care or the medical professional that, I just have this absence of menstrual cycle for 5 years. I guess I just have menopause at an early age. And the discussion was that, oh, I don't have any hot flashes, no night sweats, so I should be okay, right? Because my life is fine without estrogen, progesterone. And this fatigue and weight gain, occasional headaches is just age. Mind you, 39-year-old is not old, okay? It's not old, so never discount that, especially if you are a patient or any physicians who are attending, that these symptoms should be addressed with the right workup, okay? Subtle symptoms speak a lot. Your body speaks, and your doctor has to listen, and there are appropriate tests that could be done, which I'm revealing here. And I'm getting back to the pituitary gland here, okay? So this patient had estrogen level done. Estrogen comes from ovaries, okay? But I just mentioned to you that our command center, that's our pituitary gland, is governing how the ovaries release estrogen. So if the ovaries are not releasing enough estrogen, you have to go knock the door and check if pituitary is functioning. If the command center is still organized, it's still functioning, it still has enough manpower. Okay, and that is what is called LHMFSH. So this was tested along with pituitary hormones, because 5 years of no menses made me, it was a high suspicion for me that something's wrong with the pituitary. And it came out to be a large 2-centimeter pituitary tumor, which was, of course, I had to make sure she gets the right neurosurgery evaluation. The surgery was done successfully, and now she's back into her routine after 1 year with good levels of estrogen. Okay, so it's very important that you as an individual, even if you are not dealing with this, but at least ask the right questions, or if you're getting a blood test done, it doesn't harm to know that if I have symptom, what is my command center doing? I would want to know that in an individual who has symptoms or who has a disease. You don't need to check this if there are no symptoms or no specific diagnosis. Okay, again, wanted to remind you that if you have any questions, you can always put that in the chat box and I will get back to it one by one at the end of the discussion. Okay. What do we learn from this case is what I just mentioned, that look at pituitary as well as the peripheral organ. It could be the thyroid, adrenal, the ovaries, the testicles, but look at the pituitary gland. Now, if someone's going through early menopause or premature menopause or menopause, yes, you may not need to check hormones periodically, but you want to work on prevention. You want to figure out if hormone replacement therapy is right for you. You want to make sure that is a bone density done. You want to make sure what can I do in terms of the right supplements, right physical activity to prevent bone loss, to prevent osteoporosis, to prevent muscle loss, because that will happen and you can delay it, stop it, prevent it. All right, so now we switch gears from estrogen, progesterone, or gonadal cycle, or reproductive hormones to something more common, which is metabolic diseases or these chronic conditions. This is a 52-year-old male with pre-diabetes for 5 years, weight gain since pandemic, so almost 4 years. I saw him in early part of 2024. Sleep apnea for 20 years, as well as high blood pressure for more than 20 years on 2 medications, and high cholesterol. So we have 5 to 6 diagnoses already here. And he came to me with his spouse just giving up on life because of his weight, inability to lose weight. He's tried literally starving himself for days to lose weight, but was unsuccessful. And that has led to difficulty movement because the joints hurt as the weight is bearing on it or on them. The other aspect was low self-esteem, that I don't feel like socializing with anyone else. I don't like to go out for walks with anyone else. I get short of breath very easily. I'm just deconditioned and I think I can't do anything with my life. But here is where you can get, again, the right expertise. And I would never give up on hope for my patients because there are always solutions we can work with. Now, prior to seeing me, this patient was again seen by his medical professional locally, and he was told that, oh, maybe your energy is low, maybe you're gaining weight because of low normal testosterone, and let's just start some injections. So he had already lost hope, the patient. So he decided, okay, it doesn't matter. I'll add another medication on my list and try this. Tried it, no change, like nothing whatsoever, not even 1%. And that's where he called my office and we met here in Fresno. He drove all the way an hour and a half from Northern California. But what was interesting is that he was ready to work on his health. So I call this as a readiness or a psychological scale of how ready the person is. He was 5 on 5 ready for making a change in his life. He was just tired with all these conditions and medications. What was happening here? Why am I sharing this with you? Now, when I got his story, it was a long, almost 2-hour consultation, but when I heard his story, what it led me to the resolving of a jigsaw puzzle. Weight gain, sleep apnea, prediabetes, chronic stress and feeling low, trying to starve himself to lose weight leads to suppression of the hypothalamus and pituitary. Okay, so what happens is your body is trying to conserve energy. So it'll tell your command center that, this person is not feeding me, or this person is always in low mood, or this person's metabolism is too slow. Let's just suppress the least important hormone for existence. And what is that? It's the testosterone and estrogen in females. We don't need these hormones to sustain life. That's why I mentioned that only insulin, cortisol, and thyroid are essential for life. That is, we would not survive without these hormones, but we can survive without estrogen and testosterone. The body knows that. So the body starts shutting down those signals because we are dealing with so many stressors and long-standing conditions. And that leads to the low normal testosterone, right? So what are we supposed to address? And especially as endocrinologist, once I find that out, what am I going to address? Am I going to address or put a Band-Aid and tell him that, okay, let's push in more testosterone, versus should I address these aspects? You probably know the answer. So that's what I did. I went with the root cause analysis, and that was addressing all these aspects. And lo and behold, I just met with him 2 weeks ago. He is off his blood pressure medications after 2 months. He is not using his CPAP. He is not using testosterone. His testosterone levels are amazing. And he's off the cholesterol medications. And the best part, he's lost 60 pounds. He looks 20 years younger. And this was, again, focusing on nutrition, the right fiber intake, the activity. Again, he wasn't going to the gym at all. It was just daily incorporating daily activity, gardening, and movement that helped him to get to this specific number, and he has a better goal after this. The mindset change, the one-on-one coaching and expertise, the amount of time and back and forth exchange that patients have, sending their weekly logs to me, sending their emotions to me, sending their progress to me, as well as certain days when they feel like, oh, these were my cheat days. Not a big deal. Cheat days are not cheat days. They're fun days. Okay, if you're consistent most of the times. Including, take a look at these graphs. He has reduced his risk factors so much that he got a cardiac clearance to go for intense exercise, which is going to be our next goal. All right, so that's also very important. Get the cardiac screening done. Get the, if someone needs the stress testing or coronary calcium CT scoring before you engage in intense exercise, that's going to be important, rather than just thinking, oh yeah, any form of exercise and food changes will help me or will not help me. So it has to be a very, you have to be very knowledgeable about what you are going to undertake. And of course, getting the right expertise, accountability is going to be crucial to get to a goal where this individual got to. So what's the take-home point here is get the right hormone evaluation. Again, in this person, I knew that the LH FSH, the pituitary hormones, were not sending signals, and I need to address the root cause, which was all these conditions, and that helped him to bring back his testosterone level to a very, very optimal one, and not need any replacement. Okay. So that's the patient stories. Again, if you have any specific questions on this topic, go ahead and put that in the chat box, and I would be happy to answer it at the end. I talked about hormones. Diabetes is also an endocrine condition. It is also a hormonal condition because it is directly linked to insulin as well as glucose. And it's one of the most common and the number one almost condition, which is an inflammatory condition, which affects or causes inflammation throughout our vasculature, blood circulation. It is the main cause or for cardiac or heart complications. So it's going to be crucial to attack this when we don't have it. So prevention, or if someone has pre-diabetes, can we prevent type 2 diabetes? If you already have a diagnosis of type 2 diabetes, can we reverse it? Depending, that's a different discussion. But can we improve it? Can we get to a better target? Can we prevent complications, right? So you always want to question the why when either you're thinking about prevention or if you're dealing with a condition. I am, again, not going to get into the details of this slide, but I just wanted to bring about a very important point that insulin is affected by a lot of other aspects in our health. So, and the chronic stress response. So how do you interact with people? How do you respond to anger? How do you respond to a conflict? How do you respond to, unnecessary, I wouldn't say unnecessary, but how do you respond to emotions? or are you or are you not paying attention to your sleep? Are you not paying attention to your food habits? And that's disrupting how your digestive system is working, how your bowel movements are working. Everything affects your glucose response. So it's not just a problem with the pancreas, but everything around the body or inside the body is going to affect type 2 diabetes. Insulin resistance is actually the main cause for most of the patients with type 2 diabetes. And this is what is being addressed with us when we see patients or when I see patients. Why am I just bringing this topic to you? Insulin resistance is because take a look at this entire slide. There are so many conditions that are related, or the root cause is insulin resistance. Okay, and where is this main problem occurring from? High caloric foods, high fatty foods, physical inactivity. So basically poor nutrition and inactivity, our sedentary lifestyle is leading to insulin resistance. Okay, you may be young and you may feel that, that's not important for me. But as we progress into 30s, 35s, 40s, this is going to creep up if our habits are the same or the ones that don't suit our body. Look at the right-hand side. These individuals tend to see so many specialists just to get their insulin resistance addressed or come up with new diagnoses. Okay, so what's our take here? This is what I tend to, again, discuss with my patient. Doesn't matter what symptom or what diagnosis they come to, this is going to be crucial. Simple habits, increase your fiber intake. In general, we don't have enough fiber, so go up to 25, 30 grams of fiber. Make it simple. Don't remember the 25, 35, but am I adding fruits and vegetables or beans, whole grains, nuts, seeds almost in most of my meals or whatever meals you eat? Unhealthy fats, you want to reduce them because they may worsen the insulin resistance. And of course, processed foods. Anything that's packaged is processed. We cannot eliminate them from our lives. In this era, we just can't. But can we minimize it? Can we avoid them when we have better options, right? Why is this crucial? It's because this is what's helped my patients to optimize their health. So be it reversal of diabetes, be it improvement in the diabetes health, be it prevention of heart disease. In the patient that I just talked to you about, he's got a great cardiac clearance and he was one of the best examples for deprescription. So it is possible. It's just consistency. And like I said, it is that one-on-one support, the right education, the right knowledge, and knowing that you're not just addressing one problem, you're actually looking at your entire well-being, your health, and that's where you are inviting these foods in your life, in your system. Okay, gut microbiome is a very, very crucial topic nowadays and very relevant that we have millions and millions of good bacteria in our gut. What do they need? They need this food. They need the fiber. They need the enriching antioxidants and anti-inflammatory benefits from these foods so that you can have more company, more good bacteria in your gut with you. All right. Again, any questions about these, go ahead, put them in the chat box as we're almost nearing the presentation. I'll leave this with you. You can take a snapshot or, we'll have this recording available soon, either through email and YouTube. But basic screening tests that you should be aware of. This is just a very small list. I would do different ones based on a person's or a patient's symptoms, but it's listed on the left-hand side for you. And always remember, if you're getting your estrogen, testosterone tested, think about the LH and FSH and prolactin in many cases. Think about pituitary hormones, and that helps us as endocrinologists to interpret, to make a diagnosis, to rule out a diagnosis, and not give an incorrect diagnosis. Okay. The last 3 or 4 is what I implement in my practice. These are all well studied. Apoprotein B, looking for cardiac risk and fasting insulin, uric acid, a common culprit for gout, but also for chronic inflammation, and the high sensitivity CRP. I also rely on something called as body composition, just as in our patient case or patient stories that I mentioned is because you want to know what your visceral fat or the organ fat is. It's not the fat which is appearing outside, but the bad fat is the one surrounding the organs, causing diseases, causing hormonal imbalance. So that needs to be looked at, and it's a simple body composition test, as well as waist circumference, and it's different for men and females. There are certain criteria that you want to look at. So this is how you look at, a whole person health, as well as figuring out their symptoms, their specific differentials, workup, diagnosis, and now get into the goals for, do I need to prevent disease, prevent complications, or work on longevity? All these aspects would require a good discussion, a good conversation with the right expertise. Last one is stay active, okay? Every guideline, be it American Heart Association, American Diabetes Association, will talk about 150 minutes in a week. And that's literally 30 minutes in 5 days, which we all can accomplish no matter how busy we are. Take breaks, squats, some planks, the healthier or the younger you are, move more. And the older you are, move even more. Because as we age, especially after age 40, we tend to lose muscle gradually. And it's both for men and women. And how do you gain your muscle back, or how do you prevent that loss, is by getting involved in some resistance exercises. So even if you are doing, if you're going out for walks or you enjoy the walks, wear a vest or get something heavier, which you're tolerating. And that will help to build some muscle and bone. If you are, at work, do some squats and planks. That'll help to get some muscle movement going, and also help blood sugar, blood pressure, as well as your mental health. If you have time, get some weights, try 15-20 minutes of weight-bearing exercises at home. And then, of course, if you have more time, go for a personal trainer, get enrolled in a gym, but have consistency. Make your schedule, know what your planning is, and also remind yourself that things will change. I have to adapt to those changes, okay? I don't give up. The routine might change, but you have to adapt. And that's what I tend to teach my patients when we're having these discussions, because it's an ongoing journey for health. The last piece is the breath work, okay? Again, very well studied, evidence-based, in several medical schools, they actually implement it, especially in Northeast. Where it's shown that students, when they are practicing breath work, that is inhaling and exhaling for a prolonged period, it could be double the time, or it could be just few seconds more than the inspiration, helps to stimulate your parasympathetic nervous system. That is your vagus nerve, and that is your rest and digest nerve. Okay, and that's going to help your hormones. It's going to reduce the adrenaline, it's going to reduce the cortisol, and bring it back to a baseline, bring it back to balance, so that you can perform even better and be more single focused rather than just trying to multitask. I have these handouts available. You can either sign up for newsletters or send us an email, and we can add you into it so that you could have these handouts. I also wanted to announce, which I'll provide later at the end, that there is a certified yoga teacher who is willing to offer the community one free session for mindful breathing, for breath work. So if you had to try it out, definitely send us an email, and we can give you the information so that you can directly connect with her. Okay, so we're almost done, and I hope you all have your questions. This was the bonus discussion that I just wanted to elaborate. This is the new thing which is going on for the last 2 years about weight loss, the injectables, which we as endocrinologists, especially in my practice, both in Fresno and Alamo, East Bay, I've been using it for almost more than a decade. And Ozempic has been out there since 2017, but now we have more drugs and more interest in knowing about the weight loss injectables. Is that right or wrong for me? What I would want to add here is just have an understanding that there is FDA approved version, and there is compounded version, which is coming from compounding pharmacies, and they're not regulated. Okay, so if you're on these, definitely have one-on-one discussion with your healthcare provider. Don't just think about this as a small term or a short-term therapy and things will just kick in, or you'll lose weight and life is going to get better. But it has some consequences. It has side effects. It has cautions or precautions to be taken. And you also will need the right expertise to make sure that your risk and benefits are very well assessed. I have some key points here on the left-hand side, which again, if you have friends or family or people who are on these medications or are on the compounded versions, good to share with them so they also have the right knowledge and the right science, knowing what's going on with it. My approach for my patients is, of course, the same thing, root cause analysis, what's causing the problem. And after their entire evaluation, which I just talked to you about, as well as a body composition, we have a constant conversation. Is this going to be lifelong? Do we have a goal here? How are we going to meet that goal? Can we wean this off eventually, or will I need this till I don't get to a certain goal? Because there is a rebound with these medications for most of them. You stop it, you may end up gaining the weight back. Except in certain scenarios where I have patients who work on their nutrition and muscle strength so that they don't get or deal with this consequence of rebound weight gain. So there is so much. We could already have like 5 talks about this, but I just wanted to introduce you to these medications since we were talking about weight loss, but at least have an understanding of what's what and how to get the right information and the right knowledge about them. Okay, so we're all done. And I will leave this with just mentioning that always think about lifestyle as well as, medical knowledge coming hand in hand. It would be great for all physicians to actually incorporate this in discussions with patient visits. That needs time. But if you are wanting to actually take charge of your health, this is how I would address it. By the right knowledge, right expertise. You think about your kids needing the right coach for like tennis, for basketball, for piano lessons, but even for health, we need the right coaching, right expertise, the right accountability. And if you're the ones desiring that, feel free to reach out, and I can always help you if you're in California or if you're visiting California, I can definitely help you, guide you with that. Okay, here are my contact or contact information. That's my office number. This is the email. And if you're dealing with any of these symptoms, conditions, or even you want to try to optimize your health or seeking prevention, you want to take charge of how do I work on longevity? How do I work on improving my health? Then feel free to reach out because there would be great integration of lifestyle medicine as well as the endocrinology or the hormone balance, and that will help you to go further with your health journey. So I leave this with the contact information, and I will take questions from here. Thank you very much for listening. It was such a pleasure to have you all on board here.
Great. So we received a few questions in the chat, but I'd invite all the participants to raise their hands if they have a question, and we're going to unmute them to address it in the main room. So please raise your hands if you have any question to be addressed to Dr. Makhija. We're waiting for the hands to be raised from the reaction, please.
Sure. I actually see a lot here in the chat box.
Yeah, we have a few in the chat box, but I was thinking maybe we can.
Is Dr. Yoshida, do you want to unmute yourself? Do you have a question?
Hi. So I was asking about bioidentical hormones and what your thoughts are. That usually the patients will see it like a naturopathic doctor for that.
Sure, yeah. Great one. So bioidentical, that's So bioidentical hormones are actually FDA approved. There are quite a few that we have, which are well studied, FDA approved. So when you are seeking care with your physician, definitely ask for, are these bioidentical hormones compounded versus are they FDA approved? I am not against compounded, but I don't prescribe it just because they're not regulated. The doses are way off with every prescription, and they may have a different response at every time. So the bioidentical hormones, which are FDA approved, they actually work even better because you can assess, you can look at the lab values, you can titrate or adjust the dose based on patient symptoms as well as their blood test. You had the other question was if they have history of hormone-related cancer. That would be slightly beyond my expertise because it depends on what kind of hormone-related cancer it is. So now we have so much evidence that hormone replacement therapy is actually way safer than what we thought in the past. Just because of the long-term studies and the effects on cardiovascular health, on the overall metabolism, as well as the mental health, the neurological effects of it. With breast cancer and ovarian cancer, there are certain types of hormone replacement therapy which are available, but you would just need the right menopause expert along with the oncologist. And I've had few patients where I refer them with the help of oncologists. They have been using low-dose estrogen with hormone-positive breast cancer without any recurrences. Great question. And then we have
another question from Lucy Jones. Would you like to unmute yourself? Then I think we should just answer the question as it is in the chat. Can you read it, Dr. Makhija, or should I read it?
Sure, yeah, I can see it. So 48-year-old son has not been sleeping for quite some time, stressful job, as well as family issues, sleep studies being delayed for some reason. Could his hormones be off? Again, I'm not going to assess this as a personal question, but say if you were thinking about someone's sleep is affected and they have lots of stressors, and sleep study is the right test. One thing I'll tell you that in our medical care system, there is like a long wait, but if you try to get into the nitty-gritty details, you will get the right care and the right time for the appointment. So sleep study is also available as home sleep study. Okay, I would definitely take care of that, because if sleep apnea or sleep disturbances are not addressed, yes, it is going to affect the hormones, just the way I explained that it will affect the pituitary signaling, and that might affect the feedback signaling of the hormones. If you had to check, I would make sure that you're seeking the right expertise so that those are looked at. But again, if someone's sleep study is being addressed, go get the home sleep study. It's pretty quick to access and get it available. And you just need to have a constant communication discussion with your medical care provider, because I get them, I pick up the phone and refer my patients and talk to the sleep specialist that this is urgent, please get them in sooner. So I think you may have to go that route and seek care also. Okay, we have Dion. Dion, would you like to ask your question? Yeah.
Hey, Dr. Makhija. Just wanted to ask if you have any favorite recommendations for learning more about lifestyle medicine for patients or providers, for patients who just want to learn more, and providers who are interested in lifestyle medicine who just want to get more involved and have that aspect of care for their patients.
Sure. So lifestyle medicine, yes, there is. So lifestyle medicine is 6 pillars. So it's just not nutrition and physical activity, but it's also, one-on-one care, social connection that we learn from physicians who are lifestyle medicine specialists. There is American College of Lifestyle Medicine. It's a board exam that you go through, and every physician can go through that, including you. And there are certain other healthcare providers who could get a diploma in this specific field. And if you had to learn more, come join me, shadow me. I would love to teach you. But yes, very much needed for, I feel like, every medical professional, so that we can integrate both of these evidence-based sciences in our patient care. I do have a lot of resources. I don't know, since you guys are listening and Dion asked about resources, I have a lot of handouts. So if you just sign up for newsletters, there's or send a guide, which has at least 10 different educational handouts, which talks about lifestyle medicine and specific diseases and how you can initiate a conversation even with your physicians or get the right resources so you can implement certain changes and certain steps right away, rather than just a Google or internet search. Thank you for the question. I have Karen Hughes. Karen, you're here. So go ahead, you can share your question. Okay, maybe I'll read her question. For hormone replacement therapy, is there an age that is not recommended? I had read studies in the past that over 60, it was not recommended. Yes, those were the previous guidelines. And when we talk about hormone replacement therapy here, Karen is specifically asking about estrogen, progesterone, in certain cases, testosterone, the ones which are FDA approved. So within 10 years of menopause. So if someone's had menopause at age 50 and within that 10-year span, once you get a good risk stratification, you could qualify for the hormone replacement therapy for symptoms, for bone health, for prevention of osteoporosis. If it's more than 10 years, it's a little tricky. And that's where you need the expertise to figure out that, oh, it's just 11 years and you still are in that window versus it's been 15 years since menopause, then it would be, it might add more risk rather than benefits. Good question. We have
Yes, we received a few questions on the email that I think I'd rather read if it's okay like this. So, for example, one of our users asked, if I have thyroid nodule and my doctor says I don't need thyroid hormone, is that right for me?
Sure. So it may be right. So thyroid nodule is a lump on the thyroid gland, and not having enough thyroid hormone is a blood test. So two different things. I would look at ultrasound, which I do at the bedside, to look at the lump. If I need a biopsy, I get that done. It's not cancerous. You're good to go. Thyroid hormone is looked through the blood test, which is TSH, free T4 or free T3. And if those levels are abnormal, then you treat it. Treating thyroid hormone is not going to fix the thyroid nodule. So just to simplify it, two different conditions. So you will have to address it accordingly, rather than thinking one fix will lead to the fix of the hormone deficiency or hormone excess. So you have to get addressed separately. And I guess your physician has already tested your thyroid hormone. And if that's normal, then yes, you don't need to use hormone replacement there with thyroid hormone. Thank you.
Great. And the second question would be, what about infertility and polycystic ovarian syndrome? Do lifestyle interventions work in this case?
Yes, in many cases. The reason I said many cases is because infertility may be related to PCOS, and PCOS may be related to weight or insulin resistance, and then the weight loss with the right interventions, just like the patient we talked about, will help. So my patients, I will work with them depending on how soon they want to conceive. So if I'm seeing them for if they don't have any plans for conception, then we have enough time to work on lifestyle interventions. And that shows great outcomes, great results in improvement of their menstrual cycles and improvement in the ovulation and successful fertility. If the time limit is too short, if you're going through IVF, then we may have to use the right medications to get to the right goal. And of course, look at other causes of fertility. It may not be PCOS, it may be something else. So address that, and then I would, talk to your fertility specialist, your gynecologist to collaborate your care, and then help you with still lifestyle interventions, but you may need some support with medications. Thank you.
And I have a last one received on the email. What's the difference between pellets for estrogen, testosterone versus hormone replacement therapy?
Okay, so very similar to the first question that we had. I actually had this discussion even yesterday with one of my patients. She was on estrogen and testosterone pellets. Pellets are basically tiny, just imagine pellet-like hormone made pills, which are compounded. So they're not, again, regulated, and they're inserted by clinicians underneath the skin. And then they release the hormone gradually entering into your circulation, and that might give some benefits. Now, these are not regulated, so there could be a spike in your hormone levels initially, and then gradual decline where you may get symptomatic. So because these are not regulated, the response is not the same every day. Versus FDA-approved hormone replacement therapy, we have more control over adjusting the dose, relying on the blood test, relying on the patient's symptoms. And of course, they're well studied, so you know what to expect in terms of side effects, long-term benefits, as well as bone health. A very crucial aspect is pellets are not studied to prevent bone loss or osteoporosis. So I would be very mindful that don't take it just because they'll claim that, oh, I'll get hormone replacement therapy with pellets, but it's not supposed to help with your bone health. So you may take it in vain and not see a benefit in your osteopenia or osteoporosis. Yeah, thank you. There is one more I see on the chat. What is the biggest factor that will increase longevity? That is not dying early is okay, so longevity may be defined in different ways. I would highly recommend to see Blue Zones on Netflix. It's a five video series, and what they talk about is high fiber diet and physical activity. None of these movies or none of these studies show that you have to go to the gym to build muscle to improve longevity. But the more active you are, the more social connection you have, the more family time and separation of work and family, right? So then the stressors that we bring home, the more you know how to disconnect, the better you are with your longevity, because it's not just absence of disease, which is health, but it's also your social, your mental, your psychological well-being. So nutritious diet, high in fiber. The second one is getting your protein, which is going to be lean meats or your lots of plant-based proteins. And the third is physical activity, movement. We just talked about the recommendations. Social connection is one of the keys, and a spiritual connection. So knowing your purpose, that's been very, very well studied, and reminding yourself every day is definitely a key aspect for thinking about longevity or living happily, no matter how many numbers we have in our life, so that you have a successful journey on this earth. Thank you.
And I have a personal question. How can we increase the happy hormones in a sustained way, for example?
Sure. Yeah. Yes. We do that with laughter here at our practice, as well as with our patients. And, I'll do that sometimes at the community event. But there are a few things, just having a fun time is going to raise our endorphins. Endorphins are happy hormones. And where they're coming from is morphine is a painkiller. Morphine term came from endorphin. So we have our own painkillers, our natural ones. So eating some good foods, dark chocolate has been well studied. Again, not too much. Too much is never good for anything. The second aspect is, how do you bond with your family? How do you bond with your loved ones? How do you bond with yourself? Okay, don't forget yourself. And the positive emotions that you build in is going to lead to that elevation. The third thing is, again, fiber, good foods. Okay, that's also helping with our digestive system. It helps to increase the serotonin, and serotonin is very useful to prevent depression. So it's basically like an antidepressant. Jump, laugh, enjoy. It's easy for me to say don't take stress, but learn how to cope with stress. Your mechanisms are actually going to help with raising your endorphins. So yeah, great question. We all practice this every day.
Yes, thank you very much for the answer. Right.
Sure, you're very welcome. Okay, friends. So if you are good with your questions, I really appreciate your attendance and you being here and sharing your questions as well as your attention. I would definitely invite you, send me an email if you had to with any other questions, or if you wanted to get the handouts, you have the contact numbers, and I would love to see you again in another webinar if you wanted to keep in touch. Feel free, you have different ways and modes to get in touch and be with us. So thank you, and I hope you take charge of your health and empower yourself with some good tips here. Thank you so much.